The van is called the Mikinakw. So it's the mobile Mikinakw clinic. The clinic is more than just medical services that are going to be deployed. We also have educational services, intervention workers. It's going to be a little bit of a mobile friendship center.
Why a mobile van?
During the pandemic, we started to change a little bit of our practices. Considering that we weren't able to open our doors to be able to serve our members, we started to go more towards them, into their homes and into the spaces where they live. And we saw that it was the best practice, actually, that we were able to meet up with different members that weren't accessing all the services that we had at the center. So we were going to be having a nurse that's going to be there to be able to offer services, as well as traditional healers. We're also going to have intervention workers and cultural animators that are going to be able to use the mobile clinic.
And they don't ask people to get to them, they're going to meet people. So that's why I call it cultural safety. At the opposite of asking people to adapt themselves to a system, it's the system that adapts themselves to different realities.
How do you think that a project like this speaks to what happened with Ms. Echaquan and the sort of reaction in the community?
There was a lack of trust that was already in place before the events with Joyce, but Joyce really put a visual to what the reality is that a lot of Indigenous people live.
We got a tendency to see things like a check in the box, and this is not the approach I get. So yes, we've done some progress. Yes, it's better than it was, but we got to keep our guard.
It could mean life or death for an Indigenous person if they're going to be well received within the network or not. It could mean early access to treatment for cancer. It could be as simple as diabetes detection. One of our objectives is really to reach out to people who might be a little bit farther from our center and to make sure that everybody, regardless of where they are, have access to these services.